Hey folks, good morning. It's Dr. Sam, and I received a great question yesterday. How do you negotiate with your eye doctor to get a reduced prescription? Well, it just so happens yesterday a patient came in, first time I had seen her, and she shared with me that she was feeling really frustrated that every eye doctor she would go to, none of them would prescribe a reduced prescription. They just didn't believe it worked. Well, it was interesting during the exam, and she was wearing -9 in each eye, so that's pretty nearsighted. I calculated that she could actually wear a -850, so a reduced prescription. And believe it or not, her eyesight, her acuity was better, and her eyes felt more relaxed. Now, I did a research study once in my office, and this was for new patients coming in who wore prescriptions. And I found that these patients could take less prescription and they actually saw better. In fact, about 95% of them were overprescribed. And, it's the way we're taught to prescribe lenses. So we're going to invariably overcorrect people. But how do you negotiate with your eye doctor? Because a lot of them aren't into this. They don't believe it works. So here's what you do. If you're nearsighted, you ask the doctor for a distance prescription, and then you ask him for a second prescription for reading. Now, that reading prescription is something that you're going to use as a vision improvement experience. So you're going to start wearing it around the house, you're going to start walking with it, and you're going to notice that if you compare it to your distance prescription, the reading prescription is going to feel much looser, more relaxed in your eyes than the distance prescription. Now, for farsightedness, it's a little different because what you have to do there is you get the reading prescription number. Let's say it's a +250 in magnification. You can actually go to the drugstore and I would get something less, maybe a +2, and I would start using that for your reading as long as you're not straining. Now, in both scenarios, what's so important is you have to do the physical eye therapy exercises because it's the retraining and the reprogramming of the brain, eyes, and body that will allow your eyes to flex into the reduced prescription. In fact, I often say that you have to do the exercises first before you get a reduced prescription, because if you don't change the habits and the patterns, the belief systems, the attitudes, then the weaker prescription doesn't work as well in creating the improvement. So that's my message for today. I wish you the best of luck. Take care.